Post-surgically, we're going to see some obvious changes in locomotion. And so it's typically later on that we're looking at whether or not we obtained a good resolution from an intervention program. So things to take into consideration with the knee ACL management, there could be a continuation in the amount of pain that they're experiencing. That's going to have a change in the locomotion walking patterns, but also even if there isn't pain as a result of changes in some of the mechanics and therefore the biomechanics associated with locomotion and walking, running, jumping, and things like that, we may want to be able to detect that. So for example, just seeing some differences in symmetry pattern, we see here that 65% in terms of symmetry, a 35% asymmetry is rather dramatic, and we could probably pick that up on visual inspection. But once we start to approach only a 10%, it's very difficult to ascertain that without some form of technology and actually evaluating that. So this is in the ground contact time, so that's why I always look at a symmetry characteristic, because it changes the locomotion pattern and it actually changes even the performance aspect. A lot of ACL management conditions, we're dealing with an athletic or at least an active population, and they want to get back to some form of function. And who doesn't want to perform as well as they possibly can? If it's an athlete, then obviously the extent of their performance is related to their ability to perform in the environment and could have an impact on their potential livelihood, scholarship, whatever the case may be. So symmetry is one really basic and simple characteristic to look at. Just a change of 10% of that can have an influence in terms of their overall performance and maybe an overall prediction of a future condition that may result in a re-injury of that particular area. Also, when we look at the angulation during the strike pattern as they're walking, if they don't have good full extension, then they're not going to be able to heel contact with the same degree. There's also going to be a change in the stride length. So typically there's going to be a correlation between the angulation as they heel strike in terms of the stride length. Oftentimes that's going to be a result, again, as the inability to perform a complete knee extension, as well as limitation in the hamstrings of that particular affected side. And again, this can also be without pain, just a limitation in the motor control or the mechanical aspects of their condition.